So we do still have some people joining us, but I think it's time for us to get started. We will record this meeting so that other people who can't join us tonight will be able to watch the video and learn the information a little bit later on. Welcome to the HVS Town Hall Health Check presented by UAB Medicine. I'm Mike Getman, Director of Coaching for HVS. Quick reminder before we start, it would be appreciated if everyone can keep their computers muted so we can all hear what's being said by our presenters. I want to thank members of our COVID committee who've helped bring about tonight's event. The head of the HVS COVID committee is Dr. Heather Bruns. Dr. Bruns is the Vice Chair of Education in the Department of Microbiology at UAB. She's joined tonight by Dr. Claudette Poole, Assistant Professor in the Division of Pediatric Infectious Disease at UAB, and is a pediatrician at Children's of Alabama Hospital. At the conclusion of tonight's presentation, we will open the floor to questions. Please use the chat to everyone feature of Zoom to ask your questions. I will read the questions aloud and members of our committee will then answer. Thank you to Dr. Bruns and Dr. Poole. I'm turning things over to you.
Thanks so much, Mike. And thanks to all of you for joining us. Can you all now see my screen? Okay. So I just want to start out by saying that the goal of this presentation is to let all of you know what we are doing as a club to create a safe environment for our players and our families. And there's some science behind the recommendations that we've put in place, and I hope to explain some of that to you in just a few minutes. But as you probably know, COVID case numbers are high right now, and vaccination rates are relatively low in Alabama. And so it's really important that we take extra care to do some things that we can do to limit the spread of COVID-19 and keep our players playing. And so this is just a list of some of the reminders that you've seen coming out from the club and that I'm going to address in some upcoming slides. If you can get vaccinated, we urge you to do that. And if you're looking for a vaccine provider, this website will help you do that. And I'll have a QR code on the slide at the end that you can scan and go straight there. But we really want to recommend that people do practices that are going to keep our kids from sharing, transmitting this virus. And so, you know, being vigilant about not having players come to practice their games when they have any kind of symptoms, wait till those symptoms resolve, and not sharing water bottles or food, limiting our indoor activities, and particularly when we're in large groups and we're wearing masks. And so with those reminders, we just want you to know that we have all of this in mind to keep our players safe and keep them playing. And so with that, I'll get into a discussion about some of the science. I don't think that it's anything new to anybody at this point that SARS-CoV-2 is this virus that we've been dealing with that causes this respiratory disease, COVID-19. And so just as a reminder, you've probably heard a lot about this over the last several months, but SARS-CoV-2 is a coronavirus. And I'm pointing this out because the whole family of coronaviruses are really notable for this very large spike protein, which you've probably heard a lot about over the last few months as well. And in fact, when this whole family of viruses was identified first under a microscope, this spike protein was so large that it really created a halo, not unlike the halo that we see the solar corona during an eclipse. And that's how this whole family of viruses got their name. Another thing that you probably heard about in the news lately are neutralizing antibodies, and a lot of talk around what the vaccines are doing and do we need a booster. And so this is actually a picture of a SARS-CoV-2 virus. And this white Y-shaped molecule is actually the antibody that is able, a neutralizing antibody that is able to bind very tightly to these spike proteins and prevent the virus from actually attaching to our cells and causing infection. And I'll talk a little bit about that in just a few slides. So I just want to start by pointing out some common symptoms that we now know after we've watched this over several months. We can now say that the 4 most common symptoms that we observe in patients with COVID-19 is a cough and fever, muscle aches, headache, and usually what comes along with this is fatigue as well. We heard a lot over the past year about individuals having shortness of breath, loss of taste or smell, but also individuals can have a sore throat, and even some symptoms resulting in nausea or vomiting or diarrhea. And so I point this out because these symptoms can be pretty varied, and we want players and parents alike to be aware of these symptoms. And so the reason why is that as part of our policies, we want players that are exhibiting symptoms to stay home, contact your coach, keep your child home or your player home until those symptoms resolve. Your coach is going to 100% understand and support that decision. Additionally, we really appreciate that everybody's been using the COVID portal to let us know. Let us know if your player has been exposed, has had a significant contact exposure, or has tested positive for COVID-19. So these acts on your part are helping us do our part to limit the spread of the virus, which unfortunately has been tricky. So with SARS-CoV-2, what we now understand about this virus is that it has what we call a long incubation period. So what that means is from the day that you're exposed to the virus until the day that you exhibit symptoms, that's that incubation period. And so in contrast to other respiratory illnesses like influenza, influenza has about a 2-day incubation period. So if you're exposed on Sunday, by about Tuesday, you're starting to feel kind of crummy. And feeling crummy is what helps us understand we should maybe stay away from people. And so unfortunately with SARS-CoV-2, there's a significant number of days where this virus starts making a lot of copies of itself in our respiratory tracts. And so we can actually spread that virus before, in fact, we know that we feel sick. And so with regard to spreading the virus, the transmission of the virus, all respiratory viruses, is really primarily through air from person to person. And there was a lot of discussion over the past year as we were trying to hash this out about, well, is the virus, are those viral particles that I showed you in the earlier slide, are they really present in these bigger droplets, like if I'm spitting towards somebody, or are they in really small, smaller pockets, like if I'm coughing and exhaling? And so at the end of the day, there's probably spread in both modes, but simply through the air from person to person is the primary mode of transmission, which means when you're interacting with an individual, the amount of time and the type of contact that you're having with that individual can either significantly increase your risk of transmitting it or becoming infected, or diminishing it. And so risk of transmission from person to person really increases when you're in close contact with that individual for more than a few minutes, so less than 15 minutes, in an indoor setting where there's limited air circulation, so limited ventilation, and particularly when individuals do not have any kind of face covering. Again, let me go back and reiterate, simply by talking, we're exhaling particles that can be spread to another individual. So having some kind of covering is limiting that forward movement of those particles. Previously, there was also concern about transmission of this virus through contaminated surfaces. Now we understand that that form of transmission is fairly minimal compared to the transmission from person to person through the air. So you may have noticed about a month ago, we posted our COVID-19 policies. And so now that we've talked a little bit about infection and transmission, I want to move on and share some information with you about the immune response to viruses and how variants and vaccines impact that, which is why we have categories of vaccinated individuals and unvaccinated individuals, and why we're updating these policies further in these two categories. And I'll get into explaining that. But what I first want to reiterate is that vaccines have always been evaluated for their effectiveness based upon their ability to prevent severe disease and death, not on their ability to prevent infection and spread. And so last year, when the COVID-19 vaccines rolled out, they were incredibly effective at preventing severe disease, hospitalization, death. But they had this added superpower that was pleasantly surprising, which was that they were limiting infection and spread of the virus. Unfortunately, in the most recent of weeks, the new viral variants have emerged that are challenging this vaccine superpower, which means there's a change in the behavior guidance even for vaccinated individuals. So in the next few slides, I'm going to talk about this immune response and these variants and the power of the vaccines. So all viruses, in order to cause disease, they have to get inside our cells. And really what viruses do is just use our cells as virus-making factories. But in order to do that, every virus has to have a part of it. For SARS-CoV-2, that's the spike protein. There has to be a part that can attach to a part of our cells. And our cells, that part is called that ACE2 receptor that you maybe have heard about. So this interaction between the spike protein and the ACE2 receptor allows for the virus to get entry into our cells. And then once viruses do that, and this is a complicated figure, but simply I want to point out that once they get inside, they take over what's going on inside the cell, and they turn the cell into a replicating factory where a cell is churning out hundreds of new viruses, okay? Hundreds of new viruses that were just infected. And so again, the spike protein for SARS-CoV-2 is what is very, very important in allowing SARS-CoV-2 to infect our cells, which then can lead to COVID-19. And so our immune system has a number of different ways of detecting infection by viruses, but two really important components of our immune response, which not only allow us to get rid of our current infection, but also allow us to maintain that protection if we see that same virus again, are neutralizing antibodies and T cells, okay? So neutralizing antibodies are made by a cell of the immune system called the B cell. And when the B cell sees this spike protein or some other protein from a virus, it is going to produce these antibodies that can bind to that part of the virus. And when that happens, that prevents the virus from being able to attach to whatever the cell component is that it needs to get inside. As great as neutralizing antibodies are, sometimes there's a lot of virus. And so cells get infected despite the presence of neutralizing antibodies. And in that case, we need T cells, which are able to recognize when a virus has taken over a cell and has turned it into a virus-making factory. And so T cells are really good at recognizing those viral components that are present in that cell that shouldn't be there and killing just that infected cell. So as I mentioned before, the spike protein, which is so critical for the SARS-CoV-2 virus specifically to infect our cells, is why all of the vaccines that are now available to us target the spike protein. And so the 3 vaccines currently available to us, 2 of them are under what we call emergency use authorization, so the J&J vaccine and the Moderna vaccine. The Pfizer vaccine was recently granted full FDA approval, and it is now marketed and licensed under the name Comirnaty. So if you hear Comirnaty, it's not a new product, it's just the new marketing name of the FDA-approved Pfizer vaccine. And this is available to all individuals that are 16 years of age and older. So in different ways, and I should say, it's been unprecedented how many ways we came at creating these vaccines against the SARS-CoV-2 virus. But all of these vaccines focused on ways to introduce the spike protein to our immune system so that it can make antibodies that specifically bind to spike and activate T cells that can specifically kill T cells that have been, or kill our cells that have been infected by the SARS-CoV-2 virus. Now, these vaccines are certainly helpful if you've never been infected with SARS-CoV-2, but they're also incredibly helpful in focusing your immune system if you previously had COVID-19 as well. And so a recent study that has come out looked at the relative amounts of the neutralizing antibody, the antibody that can bind to that spike protein. And they looked in unvaccinated individuals, unvaccinated, uninfected. And obviously there was no neutralizing antibody to spike. In vaccinated individuals, there was a significant amount of neutralizing antibody that provided protection against severe disease and hospitalization and death. That did decline a little bit when they tested those antibodies against the variants. And I'm going to talk about those variants in a minute. What I really want to point out is that when they looked at individuals who previously had COVID-19 and also got vaccinated, these individuals had a massive increase in the neutralizing antibody levels. And these antibodies were also, in fact, very protective against the variants that are being studied currently. So why do these levels increase so much? Well, what happens is if you've already been infected with SARS-CoV-2 and you've had COVID-19, your immune system responded to the entirety of the virus. And so when you end up getting a vaccine following that infection, all that vaccine contains is the spike protein. So your immune response to the entire virus and all of its components is being boosted. It's being reminded just about the spike protein. And that's okay, because we know that the spike protein is really the most important part of the virus that we need to shut down in order to protect us, which is also why individuals that were never infected but are just vaccinated, I will say, also have a high degree of protection, because those vaccines are incredibly effective at generating antibodies and T cells targeted at the spike protein. Okay, so what's going on with these variants? What about this Delta that we keep hearing about? So viruses are really sloppy when they make copies of themselves. They take over a cell and they hijack all the machinery in the cell, but they're not really accurate at copying themselves. And so what happens is they introduce slight changes into their genetic material. And we call these mutations. And these mutations then cause little changes in the parts of the virus. Now, we call these variants right now because the changes that are happening because of these mutations aren't significantly changing how the virus infects us. It's not using a different receptor other than the ACE2 receptor, or it's not causing a different type of disease, for instance. But what's actually happening, so if we look at, this is a picture of the spike protein alone. So if we look at a picture of the original SARS-CoV-2 spike protein, and the parts of the protein that interact with our cells are represented by those little crescent moons, the changes that are present in the Delta variant, you can see that those little crescent moons are wider and longer, okay? And that represent the changes in the spike protein that now allow it to bind really tightly, bind stronger to the ACE2 receptor. So what does that mean for us? Well, it means that if before you were interacting with somebody without a mask and they were infected with the original SARS-CoV-2 virus, and maybe they were talking or yelling, animated in your conversation, and so some droplets came your way, okay? Well, maybe 10% of the viruses that are present in those droplets might have attached to your cells. Now with the Delta variant, probably 90% of those viral particles are attaching to your cells, because the spike protein of the Delta variant is just better at latching on. Okay, so that's what we're up against right now with the Delta variant and why there's such spread of the virus. So how is it that our COVID vaccines can help? Okay, well, what happens in this diagram, the blue line represents unvaccinated individuals and the green represents vaccinated individuals. So in vaccinated individuals, our immune system has a heads up to that spike protein. And so in contrast to unvaccinated individuals, where they can become infected with the virus, and the virus is going to very quickly make copies of itself, and it's going to take the immune system a little time to realize what's going on and kind of get up to speed. So it takes a longer amount of time to get that virus under control. In vaccinated individuals, your immune system has that heads up. So there is that increase in the amount of virus that's produced, which is why vaccinated individuals can still spread the virus, but for a shorter period of time, because the immune system gets that rapidly under control. And this is also why vaccinated individuals have generally milder symptoms of COVID-19. And so somewhere in between, if you are unvaccinated, but you previously had COVID-19, you're somewhere in this mix. And if we were only dealing with the original SARS-CoV-2, your second response to the virus would look more like the vaccinated response. But with the variants, your response looks more like the unvaccinated individual. And so with that, I just want to point out that because of these variants and this change in guidance, we are now updating our policies. So you'll see that update coming soon on the website. And another really important point that I want to make is that these are our club policies. These are what we think are best to keep our players safe and playing. However, the leagues that our teams play in may have more stringent policies to which we would need to adhere. So don't think that we're pulling the rug out from anybody or changing the rules. Just remember that there are club policies, but then we have to adhere to the policies of the leagues in which we play as well. So I'm going to end by reminding you all again that our goal is to create a safe environment. And then here's the slide with the QR code if anybody's wanting to access the search for vaccine provider. And then I'm going to go ahead and open up for question and answer, and thank Dr. Poole for joining me in this. She can certainly answer all of your questions about kids and vaccinations. And so we will do our best to answer your questions. So thank you all for your time.
So if you have questions, please put them in the chat section, chat to all. I will read them out and we'll let our doctors answer the questions. So it's not very often that we all get to ask anything we want of a medical professional at no cost. So I strongly urge you to list whatever questions you might have, and we'll try and get them answered right away. I'll give everybody a couple of seconds to type away.
I'm going to start out with my question for Dr. Poole that somebody asked me earlier today. Should I put it in the chat or just say it?
Why don't you go ahead and just ask it?
So, Dr. Poole, I had somebody ask me today, their child previously had COVID-19 and had a very high fever spike. I want to say she said 104.5. And so they would like to get their child vaccinated, but they're concerned about fever. Have you seen in children that maybe had it before and had a really high fever? Is there concern for parents getting their children vaccinated?
Um, you know, I think that's a reasonable concern. You know, the likelihood of having a fever response to the vaccine is there. Um, you know, but you could proactively manage that fever, right? So we know that you are going to respond to that vaccine really the 24 to 48 hour time frame after the vaccine. So if you're anticipating a strong fever response, which is really your body's response to the vaccine, which tells you it's working, I would just advise that family to take either ibuprofen or Tylenol, you know, sort of in a scheduled fashion for the next 24 to 48 hours. We really don't see fevers last beyond that time frame.
Okay.
You know, and the fever will make you feel lousy. And yes, children do feel lousy. You know, for the most part, they feel lousy the day after. My children, you know, all felt pretty lousy, not the day of the vaccine, but the following day. And so because I was anticipating that, I planned when to give it to them so that if they had a lousy day, it was, you know, it was easy enough to keep them home, and, you know, we weren't missing any big event. So yeah, I would say plan for them feeling lousy, plan accordingly, and then be pleasantly surprised if they're not, because it's not a guarantee that they will feel lousy, but if you anticipate it, then it's not a horrible surprise.
Great, thank you. And same for my kids, it was the day after, so we just kind of had a lazy day.
Yeah, gave them some Tylenol. I mean, they complained for sure. I heard a lot of complaining, but we got through it and they were back to normal the day after.
I feel like they caught up on sleep.
Yes.
I'm going to go ahead and ask one of our questions. With the common cold hitting us now, what's your recommendations when our kids come home with basically the same symptoms as COVID? Maybe sore throat, sinus congestion, the sniffles, that kind of thing.
Yeah, unfortunately, there is a cold virus that is circulating like crazy at the moment. You know, the difficulty is it can look exactly like COVID. There's no symptom that you can pick out to say, oh, this is allergies, or this is COVID, or this is a cold. So, you know, I've had that same situation in my household. I took my first two kids to get tested. They came back COVID negative. The third kid who came down with it, I'm like, okay, this is the cold, the same cold that the other two have. You know, in my son's you know, he's in middle school, at least 6 of his friends came down with the same symptoms, you know, and at least 3 of us went and got them COVID tested. So it's just a flip of the coin at this point if you're dealing with COVID or you're dealing with something else. So testing is easily accessible. You know, it's not hard to get your children tested. As long as they're symptomatic, there should be no charge to getting them tested. So I highly encourage getting them tested, because then you know what you're dealing with.
And I think I will add a piece onto that answer and maybe ask Dr. Bruns to confirm my little piece. But until we know for sure, children with symptoms that could be COVID should not come to practice or games so that our teams don't get quarantined. Once you've been tested, then you know the answer for sure.
Yeah, and I think this is part of what's driving people's reluctance to get tested, right? So if you just have allergies or a cold, it doesn't keep you out of play, versus if it's COVID, even if you're feeling well, you're sort of out of play for the next, you know, 10 days, and you have to notify everybody that you were positive. So, you know, I understand the psychology and the reluctance of why people don't want to get tested. But I just remind people, right, that for the most part, kids are going to do fine. You know, everyone you've exposed will probably do fine. But there are going to be those individuals whom you pass that COVID on to who will not do fine, you know, and that's what we have to keep reminding ourselves, that we're in this collectively, right? And so my actions will have a repercussion on some unbeknownst family to me, where the pregnant mom will get COVID and end up in the hospital, or, the grandma will die, or, these are the stories we're hearing all the time. So that is really the reason we strongly encourage testing, so we know it's COVID, so we can limit exposure to others.
Yes, 100% on the testing, but just the follow-up, we don't want any player with symptoms coming. I mean, it may be allergies, we get it, we're all dealing with that. If you all were on at the very beginning, Dr. Poole and I were discussing dealing with allergies, but we also don't want that nasty cold that is not COVID being spread to all the team members either. So we're in an age, I think we have to be proactive about changing the culture, whereas before we didn't want to be viewed as not coming to practice and the coach being upset about it. So we want to make sure everybody understands our coaches are 100% behind a decision you make to keep your child home that protects them as well as our players and our coaches. So no concerns about that kind of culture at our club, 100%.
And in fact, the opposite culture, which is the coaches appreciate that families are being careful and not infecting other players, but also not infecting the coaches and then potentially their families. So thank you for choosing the safe option every time. We do appreciate it. Are there other questions? I'm going to give everybody another minute or two just in case we have some people typing away. But it looks like the presentation was so clear that it didn't leave a lot of questions to be asked.
I always wonder, like, was it just that clear?
Question, but I can't type that fast.
Please,
Go
Jenny.
ahead, ask.
Well, Heather, you mentioned something that I guess maybe the new marketing name for the vaccine, whatever it is it not approved for 12 and over? I thought it said something about 16.
Yes, Comirnaty. Well, Dr. Poole, correct me if I'm wrong. The FDA approval for the Pfizer vaccine is now, so it's now going to be marketed as Comirnaty, but it's what we've all been calling the Pfizer vaccine. That full FDA approval is only for 16 years old and older. There is still emergency use authorization approval for 12 to 15. Correct, Dr. Poole?
Yeah, I believe that is correct. So, for people to understand the difference between EUA status and full FDA, there's really no change in the safety and science process that happens for these vaccines to be able to be used. It's more the regulatory sort of the regulatory requirement to be able to, market and brand and sell a product is just a different process to the science, right? So FDA approval for any product that's going to be marketed and sold for use in children has extra layers of things that have to happen before they get granted that full approval. So they're in the process of still doing that. It just takes more time. And a lot of people have asked me, when will the vaccine be made available to younger age groups? And it's the same, unfortunately, I have the same very unsatisfactory response that as much as we'd love to have the vaccines available, there's no way to fast forward the scientific steps that have to happen so that everybody's comfortable that these vaccines are safe and are, we got the right dose and they're having the right response and we have the right schedule, and there are predefined markers that have to be met before you can say that, and there's no way to hurry that along. So it's complicated. Approval process of bringing things to market is very complicated, but I just want people to understand that FDA approval is really more a sort of bureaucratic machine of predetermined rules, and it's slow, and there's a lot of red tape and things that have to happen that aren't necessarily dictated by the science.
So you are recommending that 12 and over in your practice and every other pediatrician practice, that it's safe for 12 and over though, regardless.
Absolutely.
Okay.
So my daughter is 12 and she's fully vaccinated. As soon as it was available, I gave it to her. I've been reaching out to people I know individually because I know there's a lot of hesitation, outright fear. People are afraid, and they're just being like bombarded with so much information. It's like it's coming at you as a fire hydrant, that it's very overwhelming. So I'm trying my very best to reach out to people who are afraid, and talking through whatever it is that they're afraid of, and getting them across that finish line. Like, I really strongly encourage people that as soon as those vaccines are available, to go ahead and get them, because the alternate is just really bad. It's not a people's equation of, oh, should we do this versus not doing it, I don't think is being explained well enough to people so that they feel comfortable making that choice.
Another question, Dr. Poole, are there certain categories of children who typically are adversely affected by the virus or affected more by the virus?
Yes, we're certainly seeing, we're seeing certain children with specific underlying health conditions that are tending towards more severe disease, but that's like a statistical thing, right? So when we look at all the cases, the statistics or the probability of someone having more severe disease, we're finding certain conditions. But I have to say, I've seen otherwise perfectly healthy children, with no underlying condition get very sick as well. So it's not that, it's not that if you, and I've seen children with lots of comorbid conditions who do just fine. So it's not that it's a pure, okay, if you have asthma, you will definitely get severe COVID, but the likelihood goes up that you will have more symptomatic illness if you have asthma. So yes, asthma for sure is one. Children who are overweight is another one. In terms of the children who've been dying, it's been children with, who are on chemotherapy because they have underlying leukemia. We've seen those children come in desperately ill and die. Sickle cell disease seems to be one. Children with diabetes is another one. So, but then I've taken care of perfectly, children who were perfectly healthy and got very ill.
Are there groups of, I'll say children, but maybe it's of people who shouldn't get the vaccine because of an underlying condition?
As of now, the only people that we caution against the vaccine is if you have a life-threatening allergy to certain very, very limited components of the vaccine. So, one of the components in the vaccine, there have been reports of people having bad allergic reactions to it. So if you But this product is actually quite common. It's in multivitamins, it's in Tylenol, it's in laxatives. So those individuals out there who have that allergy would know it. And those are the people that we recommend. You know, it's not an absolute no-no because it depends on the type of allergy they have. But though it's a very, very few amount of people that we say no, they should probably not get the vaccine. Everybody else, you know, especially if you have underlying health conditions, we highly, highly recommend the vaccine. And there's no benefit in waiting. You know, waiting just sets you up for higher risk. So if you're sitting on the fence tonight, I encourage you, there's no benefit to wait and get this vaccine.
Another one of our parents has asked the question, do you recommend children under 12 get the vaccine as soon as it's available?
Yes, because again, I think by the time the vaccine is made available to children under 12, we will have the data that we need so that I can confidently recommend it, right? Like we're not going to make it available until we know that what we're recommending is safe and effective.
Are there any other questions? Okay, it appears that you have answered all of the questions we have tonight. Thank you to both Dr. Bruns and Dr. Poole. Thank you to UAB Medicine. And thank you for attending the HVS Town Hall Health Check presented by UAB Medicine. We appreciate everybody's attendance tonight. Have a great evening. We'll see you out on the fields.
Thank you. Thank you for everybody's interest.
Yes, thank you all. Have a great night.
Thank you. Good night.